I'm here with Lisa Sanchez. She's a home health care expert. Lisa, what is home health care?
Home health care provides care to seniors in their home setting. We provide nurses, physical therapists, occupational therapists, and all of these employees travel to the patient's home and take care of them at their own home.
What do people need to know about if they qualify for home health care or if their loved one qualifies?
With Medicare, Medicare covers home health at 100%, and if you have a Medicare Advantage plan, usually it's covered at 100%, but sometimes there are a few small copays. Usually once they find out that Medicare covers home health at 100%, then they're more, prone to say, okay, let's give this a try.
What are the different levels of home health care?
So home health care, it can vary depending on the severity of the patient's condition. So if they just need a nurse, it would just be a nurse. But we do have patients, that need physical therapy as well as occupational therapy, and maybe even a CNA to assist them into the shower, 5 days a week or 3 days a week. So it just really depends on the condition of the patient. Most people don't understand that the services are provided in their home, so our employees will travel to their home and provide the services for them in their home. And our employees will be in communication with their physician, so it's like they're visiting their physician, but they're not. So our employees are, working with that doctor very closely, establishing the plan of care, and, just coordinating the care that the physician would like this patient to have. But it's all coordinated and done in the comfort of their own home.
What percentage of people that can actually use your services do you estimate even know about your services?
I would say 35% of the seniors know about home health and understand it. It's very underutilized, and we just want to get our name out there, the word out there, so we can help as many seniors as possible.
I'm here with Lisa Sanchez. She's owner and operator of Midas Creek Home Health Care here in Salt Lake County. Lisa, what is home health care?
Home health care provides care to seniors in their home. So us at Midas Creek, we have nurses, physical therapists, occupational therapists, and CNAs that will travel to the patient's home and provide services there at the patient's home.
What do people need to know about if they qualify for home health care or if their loved one qualifies?
So to find out if you qualify for home health, just give us a call. We will contact your physician and see if you have a skilled need at that point in time. And then we'll also contact your insurance company and make sure that you have coverage for that. With Medicare, Medicare covers home health at 100%. And if you have a Medicare Advantage plan, usually it's covered at 100%, but sometimes there are a few small copays. But for the most part, Medicare covers home health at 100%.
What are the things most people just don't know about home health care?
So home health care, it can vary depending on the severity of the patient's condition. So if they just need a nurse, it would just be a nurse. But we do have patients, that need physical therapy as well as occupational therapy, and maybe even a CNA to assist them into the shower, 5 days a week or 3 days a week. So it just really depends on the condition of the patient. So some patients just may have a nurse, where others may utilize, all the disciplines that we have employed here.
Oh, I would be a lost cause. I mean, my husband's wonderful, but Midas comes in, the girls that they send. Cam is the nurse, and she comes in and does all my pills for me, sets them up for the week. My daughter was getting very afraid that I would misplace or take more than I should, and so she was thrilled when Midas Creek came on the scene and could do and would do that for me. And then Alicia Woodland, she's my aide, and she comes in and helps me with the shower.
Sounds like you're really passionate about what you do here at Midas Creek Home Health Care.
Absolutely, especially through the winter months when, it's really snowy out there and we have a patient that, has a hard time even getting from their recliner to a wheelchair, and they need to just go to the physician to have a blood draw for an INR, something that's monitoring their Coumadin levels. Us being able to go in and check that in their home without the family member or the husband or the caregiver having to get them into the wheelchair, get them out through the snow into the car, that right there, is wonderful for many, many seniors. They can have things done in the comfort of their home where, it is such a challenge for them to get to their car and get to the physician's office. And we can, take that burden away from them.
But Midas Creek trains their people to be genuinely concerned, have empathy and caring that other companies just don't. But Midas Creek does.
And what kind of things have caregivers had to say about being able to have some relief from taking care
Oh
of?
my gosh, they're just so grateful and so thankful. The thank you cards that we get, they're amazing. That is the most rewarding thing about home health, is just those family members and the patients calling you and just thanking you for everything that you have done for them.
So are they finding this life-changing?
Absolutely. Absolutely. They really honestly don't know how they did it before they had Midas Creek.